afternoon. Hi, welcome everyone. I have the pleasure of speaking to two experts from leading London fertility clinic, CRGH, this afternoon, all around egg freezing in 2025. Everything you need to know, and they are here to answer your questions. So we have Suzanne here, who is the embryologist, as well as Dr. Wael Saab, who is a fertility consultant, and he is also the clinical director at CRGH. There we are. That's much better. Hi, Suzanne. How are you?
I'm very well. Shall I introduce myself again whilst you bring in?
I said that you're the director of embryology at CRGH, but please could you just tell people a little bit about what your role involves?
Absolutely. Yes, so I am a scientist by profession. I started in embryology actually at CRGH 20 years ago. And since then I've been to Barbados to manage a clinic, and then again in Harley Street, and then I've been back with CRGH for the last 8 years. So we have two clinics within CRGH. We have one in Farringdon and one at Portland. And as an embryologist, we are the cogs in the machine actually in the laboratory. So in terms of the egg freezing, we're the people who will actually do the process of freezing your eggs, and then we're also in charge of looking after them as long as they are stored. And then eventually, if you do come back to use them, we'll also be the people that warm them, fertilize them, create the embryos.
Fantastic. And please introduce yourself, Dr. Saab.
Hi, Eloise. Sorry, much better now. I can basically much better. So I'm Dr. Saab. I'm the clinical director at CRGH, and I'm also an associate professor at UCL. I have been at CRGH for around 18 years or so. So obviously, my specialty is to deal with all, obviously treating couples, single patients having treatment. Specifically, whether myself or Suzanne, we have special interest in egg freezing specifically when it comes to fertility treatments.
Wonderful. Well, that's why we're here today, to talk all around egg freezing, the process, who it's for, all the questions that our community asks us day in, day out. So first of all, Dr. Saab, I want to ask you, why might someone choose to freeze their eggs in 2025?
Thanks for the question, Louise. Obviously, egg freezing is not something new. So egg freezing has been present for several decades, but obviously it's gaining more and more popularity over the last few years. A few years back, we used mainly to freeze eggs for medical reasons. By that, I mean patients or ladies coming to freeze their eggs before having chemotherapy, before radiotherapy, before any specific form of treatment that might affect eggs. These days, obviously, what's getting more popular is what we refer to as social egg freezing, which is freezing eggs for non-medical reasons. The most common, obviously, non-medical reasons are ladies not ready to start a family. They are either basically are committed when it comes to their career, to their education. They might not be even at the right time in their lifetime to start a family. So obviously, egg freezing is one of those options that is considered a very good backup plan for the future, for ladies to use those eggs in the future to use them. One last thing to add about egg freezing, I keep on mentioning when I'm asked about egg freezing, is that in the 1960s, the contraceptive pill gave our grandmothers the option, the sexual freedom to when they want to have a baby, when to offer contraception. And egg freezing is one of those, it's among the very few things that happened over the last decades that gave women the freedom of when to choose to have a family, which is pretty important. It's a breakthrough in our field, I have to say, egg freezing that happened in the last few decades specifically.
Absolutely. And there's a lot about it in the press. So I'm glad that we're having this conversation today, because I feel like more people are talking about it, which is fantastic, because it makes people more aware of it at a younger age, gives you opportunities that, as you mentioned, you may not have had before. So thank you for speaking with me today. In terms of the process of egg freezing, what does that look like at CRGH from initial consultation through to retrieval?
So egg freezing, obviously our job is to make sure that we give the information to the public from the medical point of view. Is egg freezing is a process that approximately takes up around 2 weeks. Ladies will be self-administering injections for around 10 to 12 days. The overall process will involve 4 visits to the clinic. Obviously, we are aware that most ladies who come for social egg freezing or for egg freezing have lots of other commitments. So you can imagine that the treatment most of the time can be fitted around working hours and without interfering with ladies' day-to-day activity. So in general, it starts by checking an ovarian reserve, which is quite vital and quite a very good starting point for any person, whether planning to start a family or preserve fertility. And then after that, there will be an initial consultation where the consultant will delve into the details. What does that process involve? What are the risks? What are the complications? Then a nurse consultation. That period of 10 to 12 days of taking the injections, as I mentioned, around 5 visits, and the day of egg retrieval, which is a single day procedure, that it literally takes around 15 minutes. Ladies will be resting in the clinic for half an hour or maximum 45 minutes afterwards. And obviously, once they are ready to go home, they are free to go home on the same day.
Mm-hmm. I've often heard people say, and friends of mine actually, in fact, who have been through this process like in late 30s, for example. I wish that I had known what was involved earlier on, because I was always slightly apprehensive and slightly afraid of what it would involve and how much time it would take and what the process would look like. But actually, having done it, like you said, it was, 10 or so days of your life, to give you a really extraordinary opportunity in the future, should you need it.
Correct. As you rightfully mentioned, obviously it does need some commitment, but those most of the time can be fitted around people's day-to-day activities. As I mentioned to start with, that this is always considered a backup plan. It will never be a guarantee that those eggs will result in a baby in the future, but it's one of those technologies, like lots of other technologies, that we have to take advantage of. We are lucky to have that, these days in order to preserve fertility in the future. And I think it's one of the breakthrough treatments, as we mentioned earlier.
Absolutely. And Suzanne, I'd love to ask you, as a director of embryology, what happens to the eggs after retrieval? How do you prepare and assess the quality of eggs before you freeze them?
That's a really good question. So obviously the doctor is there performing the egg
Yeah.
retrieval, but the egg is right there alongside them, because it's very important as soon as the eggs are removed from the fallopian tubes that we are there as an embryologist trying to make sure that the eggs, or from the ovary, sorry, are there therefore going to be processed in a way, kept and cultured in just the way they need to be. So we are essentially there to keep them in the environment they need to be in. So we'll collect them straight away in the media containing all the amino acids and the energy substrates and everything that is required. We'll obviously need to find them, select them, and then get them into the incubator as soon as possible.
Mm-hmm.
So that is ensuring that the temperature is correct, the pH is correct, the osmolality. So we're just making sure the environment is perfect to keep them, as they need to be. So we'll essentially culture them for another hour or so after the egg collection. And then we will, when the eggs are collected, they are surrounded with something called cumulus cells. Now we have to remove these cumulus cells because they need to be removed for the freezing process to make sure the cryoprotectant can, do its job.
Yeah.
Protect the egg. So we remove those cumulus cells. This is done through a chemical and mechanical way. And then once we've removed those cells under the microscope, we can visualize the egg and we can assess the maturity. The maturity is actually the most important thing to see, as well as the quality. So not everybody will know that not every single egg that is collected is be frozen. So it needs to be at what we call the metaphase 2 stage of the meiosis cycle, because that's when it's ready to be fertilized. So that's where we need them to be. So we normally see about 80% of eggs that are collected for freezing. So we can also look at the quality. Now, the quality of an egg is quite subjective. It's quite difficult to. One of the most common questions is how likely are these eggs to baby? An embryo asked, how good are they? What's the grade? And we don't give an egg a grade as such. And always the most important factor is the female's age. But we can see if there are any growth abnormalities within the cytoplasm. So we can have a look, for example, like I say, any cytoplasmic aberrations such as smooth endoplasmic reticulum, vacuoles, refractile bodies, lots of things that are a negative impact. It won't necessarily mean that they won't form a baby, but it just means they're less likely to. But we'll obviously assess them, grade them, note anything like that, and then we begin the freezing procedure.
I would assume that one of the questions that you often get asked, and for anyone watching, if you have any questions for Dr. Saab or Suzanne today, please feel free to ask. That's what they're here for. Would be, how many eggs might it take to have a live birth? Is that something you get asked a lot? How many retrievals might I need?
Absolutely. It's one of the most common questions. I don't know if Dr. Saab wants to answer this, or I should. I mean, I would say female's age.
Obviously, it falls within both of our scope of work. And Louise, obviously, age, as Suze rightfully mentioned, is that age is the most important parameter. Unfortunately, age is not very forgiving when it comes to fertility. And that is a statement that is applicable for both, by the way, men and women. Unfortunately, it's a little bit of more of an age affect eggs a little bit more than sperm, because ladies are born with specific number of eggs. And an egg that is ovulated at the age of 36 is 36 years of age. And in general, the main determinant of whether any sort of fertility treatment will result in a baby or not is whether the embryo that we created in the lab has the right numbers of chromosomes. And we all have 46 chromosomes. The chromosomal abnormalities that are compatible with life are very few, like Downs, like Edward, like Pateau. But we don't have anyone around us with 3 copies of chromosome 1 or 2 or 3. That leads me to the discussion about the eggs, is that the egg has to have 23 chromosomes. So if the egg that we are freezing by any chance have 21 chromosomes, have 25 chromosomes, it will not result in a baby. And the determinant of that is age. We expect most of the eggs to be chromosomally normal when ladies are younger than 35. So a good number to have in the freezer when you are younger than 35 is in general closer to 15 to 20 approximately.
Is that if you're trying to have one child or multiple children?
Correct.
That's exactly that, yeah.
That is most probably to give a decent chance of at least one live birth. Because some of those eggs might not survive the defrosting process. Some of those eggs might not fertilize. Some of those eggs might not create embryos. Some of those embryos might not be good enough embryos to result in babies. So the figures that are in general quoted are for approximately one live birth. Yet we have seen that, myself I've seen that, Susan have seen that, of course across our career, that there are some ladies who have 15 eggs that results in 2 babies, 3 babies. There are ladies with 20 eggs that don't. But in general, the figures that we quote are to have a decent backup plan for at least one live birth. You can imagine when ladies are above 40, that is when we start talking about number of eggs more than 30, and for the reasons that we just mentioned.
That makes complete sense. Am I right in thinking that the storage of eggs, one for you, Suzanne, has improved, and historically people were sort of advised to try and freeze embryos over eggs, but now there's not much in it in terms of survival of thaw, is that right?
It isn't quite right. I mean, vitrification of both embryos and eggs has leveled the playing field, certainly. But it's still better for embryos because embryos are more robust than,
that's good to know.
So, with an egg, it either survives or it doesn't. With an embryo, it's around 150 cells. If a few survive, it doesn't really make an impact. So I'd say with blastocysts, vitrification survival rates are, around 99%. With eggs, we're still looking at about 90%. It's still excellent, but it's lower than, I would say it's definitely lower than embryos. So, and the other thing is when you've got an embryo which is vitrified, I mean, the whole point of this exercise really is that for patients that need egg freezing, the option of embryo is there. So you can't really compare one to the other. But the thing is when you do have an embryo frozen, it's already undergone so many processes. It's been fertilized, it's made its first cell division, it's gone through cavitation, it's become a blastocyst. You can see the 2 different cell lines. So it's already achieved so many hurdles that as well this survives, you've got a pretty good rate of pregnancy. And whereas with an egg, once it's warmed, it's still got to go through all these hurdles. You need more eggs in the freezer than you do embryos. So in terms of the vitrification process, it's definitely increased it and leveling the playing field, but I don't think it'll ever get to the same, just because of the inherent difference between a single cell
Of
you know.
course. And I guess that comes down to people's where they are in their life, right? In terms of whether they're looking for the future, whether they want to start the process of trying to conceive quite quickly, um, whether they're in a relationship or looking at donor sperm, for example. So many variables, aren't there, that you must see all the time in terms of what people might want to freeze.
Exactly.
And one interesting thing, basically on the topic of egg freezing, Louise, that we find lots of our patients asking, which is extremely important for people considering to freeze eggs, is that freezing eggs will not bring the age of menopause forward, and freezing of eggs will not affect capacity of conceiving naturally
Okay.
in ladies or in couple who would like to try naturally in the future.
Mm-hmm.
And the main scientific answer for that is that if a lady is born with few hundreds of thousands of eggs, and assume ladies start ovulating at the age of 13, 12, 13, 14, and you do simple mathematics, if a lady ovulates one egg per month,
I think he's frozen.
I'm going to say, I think he's frozen.
I'm sure it will come back.
So,
Are
so
you
I,
back?
so yeah, I'm back.
You're back.
So I don't know where I got cut off, but basically I was saying that if we do simple mathematics about egg freezing, so every lady is going to ovulate one egg per month, and if a lady is born with specific hundreds of thousands of eggs, and you do simple mathematics, that means ladies will carry on ovulating until they are 500 years of age, which is not the case. And that means every month the body recruits a 20, 30, 40 eggs. All of them will end up dying by a process called apoptosis, and one will end up being ovulated. This is what happens on a natural cycle. So with the process of egg freezing or stimulating the ovary to take out those eggs, we are not depleting the ovarian reserve, and we are not by no means going to bring the age of menopause earlier, and we are by no means not affecting the natural fertility. So in case a lady is engaged in a heterosexual relationship, she can always try naturally before using those eggs. This is always plan B.
Absolutely. That's good to know. Someone's asked a great question. Does PCOS have a detrimental effect on the quality or advance the age of the eggs?
A very good question about polycystic ovaries. Polycystic ovaries is a misnomer, by the way. There are not cysts in the ovaries, there are lots of follicles. Actually, if we look at the spectrum of ovarian reserve, where menopause is at one end, which means a low ovarian reserve, polycystic ovaries on the other end, which means ladies with polycystic ovaries have plenty of eggs. They have a very high ovarian reserve. Obviously, ladies with polycystic ovaries will end up, we predict in most of the cases they respond very well to ovarian stimulation. Obviously, sometimes that might affect a little bit the egg quality. So possibly we might end up collecting 15, 18, 20 eggs. We might lose some of those eggs for their egg quality that might be affected with polycystic. But in general, the subcategory of ladies who have polycystic ovaries end up having the best fertility outcome, irrespective of the fertility treatment, because the number most of the time compensates a little bit for the quality.
Okay, thank you for answering that. I hope that's helped. Someone else has asked, if a woman is 42 and has only one follicle per ovary, how many eggs could be expected to be collected per cycle where AMH is below 1?
Remember, it's a tricky question in the sense that AMH, we know as fertility consultants to interpret AMH in the context of ovarian stimulation. And just to simplify what's AMH is the hormone that is secreted by the cloud of cells around the eggs. So the higher this hormone, the better. In general, the normal reference range is quite a wide reference range. So it's almost very difficult to find a lady with an abnormal result, but you might find a result that is low for fertility. And we always prefer results that are more than 10, 5 to 10 is a little bit gray. Going back to the lady's question, so having one antral follicle does not mean that she cannot conceive naturally, by no means, but it might speak that with ovarian stimulation, we might not end up collecting a large number of eggs. It can be anywhere between 0 to 4. It will be very hard to predict. I wouldn't expect the number to be as a double digit. Possibly we are speaking about eggs possibly less than 6 or less than 7. But I repeat, response to ovarian stimulation do not by any means reflect the capacity of people conceiving naturally.
Really good to know. Thank Thank you. And does endometriosis affect ability to freeze eggs?
Endometriosis is a common illness. Obviously, we see it around 35% of people who come through the fertility during fertility clinic will suffer from some form of endometriosis. It does affect mainly if it is quite severe. By affecting means sometimes it might affect the position of the ovary, so we cannot reach the ovary for egg collection. I repeat, that is the vast minority, not the majority of cases. Sometimes it might affect ovarian reserve, specifically if endometriosis is affecting the ovary, and there's a very large what we call as endometrioma or endometriosis of the ovary. So it might be contributing, but the extent of how much it contributes to ovarian reserve, it will depend on the extent of the disease or the illness.
Thank you. We're getting some really great questions here. So if anyone else has any questions for Suzanne or Dr. Saab, please feel free to send them over. Suzanne, you've touched on it, but about the freezing process and storage process, are you able to explain it to us in a way that we understand, that's less scientific?
Yeah, of course. So we did touch upon it, saying that the success rates have massively improved, and that's because we moved from something called slow freezing to vitrification.
Yes.
Vitrification sounds quite fancy, but it essentially means ultra fast freezing.
Mm-hmm.
So to simplify it, what it means is that you expose the eggs to a cryoprotectant to dehydrate the egg, and then we have an incredibly rapid cooling temperature. So it goes from around room temperature to the liquid nitrogen temperature, which is minus 196 in fractions. So very, very high cooling rates. And this very high cooling rate, essentially avoids the ice crystal phase. So it avoids water going to ice, and the ice can cause damage in the internal cell membrane. And what it does instead is it creates a glass-like state. So that's why this has been so revolutionary in particularly the egg and the embryo freezing process. So that's what vitrification is. So we protect the egg with cryoprotectants, we dehydrate them, and then we rapidly freeze them. And then it's the opposite, obviously, when we come to warm them. So in terms of, did you also say in terms of what do we do with storage as well?
Yes, exactly.
So we freeze the egg like that, and then we keep them on a device. So each egg, or maybe you'll freeze 2 or 3 eggs per device. You can just call it a straw, and they are kept in liquid nitrogen. So we have these very specialized vessels. Imagine. I mean, I think people have probably seen lots of videos of these liquid nitrogen tanks by now, but they're essentially these large tanks, kind of very fancy, that contain liquid nitrogen, and then we keep all of the samples in them. Now, they're obviously, in terms of safety, they're always, especially in the UK and I think around the world now, it's you have to keep them alarmed at all times to make sure that the temperature is continually monitored, to make sure it's kept at this very low temperature. And they're always kept behind, kind of locked doors that only proper members can get into. So they're always very safe. So that's the storage facility.
And in terms of the length of time that you're able to freeze eggs, what is that time limit? And has it changed in recent years?
Yeah, so the time limit you can keep an egg stored is legal, rather than sort of a scientific reason why you couldn't keep them. I mean, theoretically, we haven't been able to keep eggs for too long. There hasn't been a lot of research done, but all the research so far dictates that it doesn't really matter how long you keep an egg stored. Mm-hmm. It's kind of warm it the next day or 20 years later. So the limits with storage have really been legal. So in the UK specifically, you used to be able to freeze them for a maximum of 10 years, unless there were medical reasons why you stored those embryos for affected premature infertility, and then you could store for up to 55 years. But the HFEA changed that law in 2022, much to everyone's, everyone was very happy about it. So now everybody can store for up to 55 years, albeit you do have to renew that consent in 10-year intervals. So you can't consent for 55 years right at the beginning, unless you're an egg donor. It's 10-year intervals.
Okay. That's really interesting to know. We've had quite a lot of medical questions come through. Please head to our link in bio, because you should arrange to speak to the team at CRGH, who can give you personalised advice and see you for consultation. So please do check out their website through our link in bio. I wanted to ask you, Suzanne, if someone decided to freeze their eggs later on, what does the process look like? Well, I guess we've talked about the thawing for to fertilization. I guess we've talked about success rates as well, and how obviously with younger eggs, those success rates are going to look different depending on when you froze your eggs. Is there anything else you feel we haven't covered in that area that would be worth people knowing?
I think one thing, Louisa, this good mentioning is the risks of the
Yeah.
treatment. So obviously, like any other medical treatment, it has its own risks. The risks are pretty rare, but they do exist. Some of the side effects of the medications, for example, might be associated with a complication called hyperstimulation. Uh, there's the surgical risks of the treatment as well. I have to admit that obviously there are lots of medical measures that we do to try to mitigate or to lower those risks quite significantly. So we at CRGH, we are a clinic that we offer our services 7 days a week. So we have 7 days egg collections, 7 days egg freezing, so including bank holidays. So the only bank holiday that the clinic currently closes is literally Christmas and New Year, but the rest of the year we are completely open. Obviously, a common question besides the side effects is that can I carry on working during the treatment? And the answer is yes. It does take most of the time, people should be in and out of the clinic within half an hour. Obviously, it depends whether work is accommodating or not, but most of the time people can still carry on working. Obviously, the day of egg collection, most people will try to take that day off. Apart from that, a common question that we have, do we gain weight during the treatment? And most of the time, the weight that people gain is a couple of pounds or few pounds. Mainly it's fluid retention. So rather than fat, rather than muscle. So most of the time after egg retrieval, we do expect ladies to have a period within 5 to 10 days afterwards, depending on the drug regime. And once the period starts, it's in general a good sign in the sense that everything should go back to normal. So that means all the hormones that were took during the treatment has already washed out. So this is when it comes to the things that I wanted to add when it comes to the treatment. One last thing is that sometimes ladies might require more than one cycle to have a decent number of eggs collected. And that's why currently at the RGH, we have those packages where if people commit for 2 cycles or 3 cycles, they will be cheaper than 2 or 3 done separately. Obviously, as clinicians and embryologists, we are not the best qualified to help when it comes to cost, but people can always downgrade. By that, I mean, sometimes we start the treatment, we tell ladies you might require 3 cycles to have a good number of eggs. And after 2 cycles, we had enough eggs. Obviously, whatever was not done, patients will have a full refund of. I think we covered the basic aspects of what we wanted to discuss about egg freezing. Going back, it's definitely one thing that when it comes to fertility is that you should never delay fertility treatment or fertility preservation once you make up your mind. Because
Absolutely.
time is the only thing that unfortunately is not forgiving, whether it comes to starting a family or preserving eggs or sperm or any form of fertility preservation.
Absolutely, and you can't get it back.
And obviously,
And I was going to say, adding to that, Mr. Saab was just saying, depending on we touched upon earlier, depending on how big you want your family to be, that will obviously affect how many cycles you want to have. But your very first question was, why are people freezing in 2025? And it's also because people are so much more educated and know what we want. So it may be a woman's like, you know what, I know I'm going to want 2 or 3 children, and
100%.
going to get to start until I'm 38, 39 years old. And okay, maybe my first child I'll be able to conceive easily, but by the time for my second or third child, then I'm going to be in my 40s. And so it's also about that planning. It's like, okay, if you know you're going to be in your mid to late 30s when you start and you want more than one child, maybe egg freezing is a good idea then as well.
Absolutely. And it's also really useful to know that CRGH offers these assisted payment plans, because affordability is something that often people will struggle with when it comes to fertility, egg freezing, etc. So being able to have options to help you on your way, to be able to do it at different stages of your life, is fantastic. So I do urge people to go to our link in bio to check out treatment plans that you offer, and have that personalized advice and consult to really work out what the right plan is for people. We've had lots of other questions, so please do head to our link in bio, and Dr. Saab will be very happy to set up a consult with you. The team will be delighted to help. I do want to ask you one question that's just come in, which I think is important to mention because you mentioned it yourself. How do you mitigate risks of OHSS in 2025?
Before I answer this question as well, obviously we forgot also to mention individuals transitioning, freezing their eggs to preserve fertility. So obviously that's one of one of the reasons that obviously we are seeing more commonly. Going back to the risks of mitigating, obviously starting at a lower dose when it comes to ovarian stimulation or adjusting the dose of medication is the first thing that we do. Number two is close monitoring during the cycle by doing regular scans and blood tests and adjusting the dose as and when is required during the treatment cycle. And the last thing is giving the right trigger injection at the right time. One medical information is that if I have a patient of mine contacting me to say, I'm taking the injections and I feel I have hyperstimulation, in general, hyperstimulation is an illness that happens after we take the eggs out. In general, it's an illness that happens around 4 to 5 days after taking the eggs out, mainly triggered by the trigger injection. So giving the right trigger injection is one of the key factors in mitigating. So lower dose, frequent monitoring, the right protocol, and the right trigger are mainly the main things that we can use to mitigate the risks of hyperstimulation.
Absolutely. And that's why I think it's so important that people seek the right advice from a top leading clinic such as CRGH to ensure that you're getting the best possible care. So thank you for your expertise. Really appreciate it. Last question. Common myths that you hear about egg freezing that you would like to bust?
Would you like to start, Suze?
I'm trying to think of common myths. I can't think of any,
I
to
think
be
you've
honest.
mentioned some actually at the beginning, you know, about how it might bring on menopause
That's
and things like
true.
that.
That's true. Bringing in menopause, does basically having frozen eggs will increase the risk of having a child with an anomaly? And the answer is no,
Yeah.
it's not related. And will freezing my eggs basically improve chromosomes? The answer is no. Unfortunately, once they are frozen, so whatever is there is going to still be there 10 years or 11 years down the line. So when we freeze those eggs, we are freezing them very close to absolute zero temperature, obviously not as close. So we believe that whatever happens in our day-to-day life right now is happening at minus 100 something degrees Celsius, but at a very low space. That's why as long as within it's our lifespan, which is the whatever 90, 100 years, it's unlikely for things to change when it comes to the eggs. So that's the most common. The most common is menopause, abnormalities in eggs, natural fertility. And the answer is no for all of those.
Great. I really appreciate both of your time. Top advice, as always. It's been a delight speaking with you again today about such an important topic. And I urge everyone who is interested in finding out more about the process, everything we've discussed today, to head to our link in bio to speak to the wonderful team at CRGH. So thank you for those who have joined and to those watching back, and lovely to see you both.
Thanks so much.
Many thanks, Louise. Enjoy
Thanks.
the rest
Have
of
a
your
nice
evening.
evening.
Take care.
Bye-bye.
Bye-bye.
Bye.
Bye-bye.